Please.
I'm Dr. RadheShyam Naik. I'm a medical oncologist at HCG and Samprada Hospital. And today we will be talking about the preventive aspects of breast cancer. Is that right?
Yes, sir.
Okay. So breast cancer is one of the most common cancers right now in the world, and in India also. In women, I think it has emerged as the #1 cancer, and both men and women put together also in our country, probably breast cancer emerges as the #1 or #2 cancer. That is one important thing. The second important thing is because of the increasing life expectancy, because of better diagnosis, and because of the westernization of our culture, I think there is a tremendous increase every year of in breast cancer incidence. So it is not a static cancer which is high, it is increasing every year. The third important thing is the results which we get in our country are much worse than what a standard westernized country gets as far as the breast cancer survival is concerned. This is mainly because of the delay in the diagnosis. So whereas in the West, mostly stage 1 and stage 2 cancers are detected, in India, many of them come in stage 3 and stage 4, what we call as advanced cancer. As far as the preventive aspect is concerned, there are two things. One is called primary prevention, where we want to prevent the cancer incidence itself. The cancer from coming itself, we want to prevent. So there is primary prevention. And then we have what we call as screening. So screening means where we detect cancers very early, but there is cancer already in the body, and then try to detect them at stage 1 or stage 2, and then cure them with a simple treatment like surgery or radiotherapy and chemotherapy. The most important thing is to prevent the cancer altogether. And since we do not know exactly what causes breast cancer, we don't have a specific etiology for breast cancer like we have for lung cancer. Smoking, we know tobacco smoking produces lung cancer. We do not have a simple, straightforward etiology for breast cancer. But we know the risk factors. The most important risk factor is age itself. Anybody who is above the age of 50, I think is at risk. And there is family history. If you have a strong family history, 1 or 2 of your first degree relatives or 2-3 of your second degree relatives are having breast cancer or ovarian cancer, then we can say that you have an increased chance of getting the breast cancer. The third thing is the obesity. One of the reasons why there is tremendous increase in breast cancer incidence is increased incidence of obesity. And we know that fat in the body converts all the steroid enzymes, steroid hormones into estrogen. And there is a hyperestrogenic state when there is obesity. So control of obesity is a very important aspect of preventing the breast cancer. The fourth aspect is exercise. We know that exercise can prevent some of the cancers, about 15 to 20% of the cancers. And breast cancer is definitely one among them. And the exercise not only reduces obesity, it also has a direct impact on preventing the breast cancer. There are other aspects to it, which I think it is not the right forum to go into. The fifth is about the diet. So I think if you reduce the animal protein, animal fat, and take a lot more vegetables, fruits, and all that, maybe vitamin D to some extent is supposed to be protective. So that also can be an important preventive aspect. Then we come to the habits. Smoking, for example, smoking has benzene, and benzene is one of the reasons for breast cancer. So smoking, quitting smoking, not starting smoking is very important. And as we know, lot of women now have started smoking, and that also may be a contributory factor for increase in the breast cancer incidence. Alcohol is another very important reason. And I think, again, we know that women taking to alcohol has tremendously increased in our country. And of course, in the West, it has been there for a long time. And maybe that is also another reason for the breast cancer. Other than these factors, there are reproductive factors. For example, the estrogenic phase from menarche to menopause, if it is prolonged, let's say you have menarche at the age of 10 or 11, and you have menopause at the age of 60, then you have a very long period of estrogenic stimulation, and which can increase the incidence of the breast cancer. Then we also have usage of pills, estrogen progestin pills or estrogen alone pills or progestin alone pills. So especially estrogenic pills and estrogen progestin pills can increase, though there is a lot of controversy about that, can increase the incidence of breast cancer. And any other reason for hyperestrogenism, you use estrogen patch or estrogen replacement therapy for severe menopausal symptoms, for example, can increase the incidence of breast cancer. And the other reproductive factors are age at the first childbirth. If it is more than 30 years, then you have increased chances of breast cancer. And if you have not breastfed the children, babies, then also you have an increased incidence. And there are some biological basis for all these reasons. But it's important that women who have had first child after the age of 30 should be closely screened for breast cancer more commonly, and they should take care about other risk factors like exercise and diet and all that. So there are plenty of risk factors like this in breast cancer. Since we don't know the exact etiology of breast cancer, exact triggering factor, so we need to take into consideration all the risk factors and then work towards that. Now there are genomic analysis which we can do. For example, BRCA gene, BRCA1 and BRCA2, these are the breast cancer related genes. I think if they are mutated, these are cancer suppressor genes, and then if they are mutated, then cancer incidence increases. And a woman with BRCA1 or BRCA2 mutation has got 70 to 80% lifetime chance of developing a breast cancer. And BRCA mutations also increase the incidence of ovarian cancer. And so in some families, the breast cancer and ovarian cancer can occur together. Either the same woman can develop breast cancer and then later ovarian cancer, vice versa, or some member in the family will develop breast cancer and some others may develop ovarian cancer. I have seen two the families, very, very prominent families, where the grandmother, mother, and the daughter, 3 generations, all the 3 of them had breast cancer. And also I have seen one generation, 5 sisters having breast cancer, 3 of them breast cancer and 2 of them ovarian cancer. So the testing of this BRCA gene may be a very important advance in breast cancer prevention. And even the male relatives of these women, if they are also carrying BRCA, can develop other cancers like pancreatic cancer, they can develop testicular cancer, they can develop brain cancer and all that. So it's an important genomic analysis. Now this is about the preventive aspects. Now we come to screening. So what are the methods we have got for screening? So we have a breast self-examination where woman is taught how to palpate her own breast while taking a bath or in front of the mirror. Systematically all parts of the breast are palpated and even inspected in the front of the mirror. And then anything which is suspicious, they can report to the doctor. And then there is second one is clinical examination of the breast, where a doctor who is well versed with breast examination examines the breast and finds out whether there is any area of concern, and then we need to go for mammogram or ultrasound of the breast depending on the age of the patient, and biopsy if necessary. This is the second screening test available. Then the third test which is available is mammogram. Mammogram is a low radiation X-ray, soft tissue X-ray, and very small lesions also can be found out in this. And mammogram, especially now digital mammogram, has revolutionized the diagnosis of early breast cancer. But though it is very useful, and women above the age of 50 are recommended at least once in 2 to 3 years to undergo bilateral mammogram. Younger women, especially those who are below the age of 40 or 40 to 50, may have dense breast, and the early breast cancer may be missed by the mammogram. In such situation, ultrasound of the breast can detect these lesions. So that is why now in any woman, we do both mammogram and then ultrasound of the breast, both of them together. The sensitivity and specificity of the diagnosis of early breast cancer improves when we use both these modalities. Sometimes you have some suspicious lesion and you may not be able to say whether it is really benign or malignant. In those situations, MRI of the breast can be a very good test, especially the patients, women with a family history of cancer or who carry BRCA mutation. We do MRI every year to follow them up to see whether any suspicious nodules are developing in the breast. And whichever of these modalities we find a suspicious lesion, then we go for the biopsy. And of course, biopsy is the ultimate test, and will detect the cancer in this situation. So these are the things. There are some new things which have come up, like thermography, where the area of malignancy shows increased temperature, and this is detected by the machine, thermography. Then there is a new machine which has come called elastography, where the elasticity of the breast is tested in whole breast, and there are areas where elasticity is lost, and these areas are subjected to mammogram or MRI or ultrasound. And then if found suspicious, we do the biopsy. So there are now instruments available which will reduce the chances of undergoing mammogram, because mammogram after all is an X-ray, whereas these elastography, thermography and MRI are much safer options available, and we can use them when all of them are used in proper situations. I think the chance of missing a diagnosis of early breast cancer or diagnosing a cancer when there is benign nodule will come down dramatically. So in nutshell now, breast cancer can be prevented with the right lifestyle. Of course, we don't know what percentage of them can be prevented, but substantial percentage of patients can be prevented from having breast cancer if they follow a right lifestyle, as we have seen what are the risk factors and how to avoid them. On the other hand, early breast cancer can be diagnosed, biopsied early, and with surgery and whatever other modalities of treatment, we can ensure very high cure rates for these breast cancers. The problem is not the availability of the methods to detect. The problem is the mentality of people not to go to the doctor until they are sick. The concept of prevention, concept of early diagnosis is not very prevalent in India, and our mindset also is not really conducive to this. I hope that these changes, and our insurance companies and all that will have programs where these screening methods are paid for, so that this becomes a success. Thank you very much.
Thank you so much. Thank you very much, sir. And so anybody has any questions for Dr. RadheShyam? So one question.
Sir, what about IVF treatment?
Ideal treatment?
Will it increase breast cancer?
What treatment, sorry?
IVF, infertility, in vitro fertilization.
Yeah, you see, in IDF, what happens is there is very, very severe and very high dose therapies, and there is a lot of hormonal changes which are going to happen at that time. So, though I think there is no definite proof, we have seen a lot of these people who have had infertility treatment coming with cancer after several years. Whether it is really related or it's coincidental, we don't know. But I have a suspicion that to some extent it is responsible for at least some of the breast cancer.
One more question is there. She has asked that, sir, I have been diagnosed with first stage breast cancer in 2022 suddenly. And as you described the reasons, I didn't find anything. So we took Dr. Tahir's treatment and has recovered. So it has come out negative. So any more guide to prevent it further? So it was DCIS, sir.
DCIS, okay. Since this is the DCIS, I think it is not an invasive breast cancer. So did she undergo any surgery?
No, sir.
No surgery. Okay. Of course, the chances of DCIS turning to invasive cancer is about 1% every year. If it is low grade, if it is high grade, it is about 2 to 3% per year. It will turn to invasive cancer. So if it was low grade, then probably she has got very little chance, 1% every year of developing. So my suggestion is at least once in 2 to 3 years, she can undergo either mammogram or ultrasound, depending on whether she is below or above 40 years. Ideally, both every year.
Yeah.
Sorry?
She's 60, above 60.
Above 60. Then I think mammogram, but better to do ultrasound also along with that. And so that if any increase is there, immediately surgery can be done. Biopsy can be done, and then surgery can be done. Otherwise, there are a lot of women who live with DCIS for a long time without it be turning to full-blown cancer. So probably you can just follow up.
Can you hear me? Hello?
Yeah.
Sorry.
Yes, sir, can hear you now.
I just had a question for the doctor. What's your opinion about genomic screening? Because that is something which is still very, very nascent in India, especially for breast cancer.
See, indiscriminate screening everybody, unless the cost of the screening comes down dramatically, is not very productive. But if you have a family history, if you have high risk, for example, you're obese, you don't do exercise, you have other issues, then probably you can be screened. If affordability is not an issue, then screening is okay. Genomic screening is okay. But the thing is, it may not be one-time screening, and also it should be a broad-based screening rather than only about BRCA. So maybe there are other familial genes which are there, and even if you do not have genes, you have in India, for example, 1 in 15 chance, 1 in 15 women develop cancer, and most of them will not have family history, and most of them will have no genomic abnormality. So it can sometimes give you a false assurance,
right,
also. So you should take it in a right environment. You should be first counseled about the implications of doing this genomic testing. And if you find positivity, what are we going to do? If it is negative, what are we going to do? For example, if it's positive, you may have mental issues. You may get depressed, you may get anxious, and those kinds of things. Whether it's worthwhile, we have to look at. And if it is negative, you may be falsely assured that you may not get breast cancer, but you still have a chance. 1 in 15 chances that you will develop breast cancer like any other normal woman. So I think it is useful, it can be done, but we have to be careful about these issues.
Got it. Got it. And in your opinion, in terms of mammograms, while typically it is, I mean, the benefits far outweigh the risks. But what is your experience been? Have you seen any sort of, repeat mammograms? Have they caused, because there's a lot of talk about how, the tissue gets damaged every time you do mammograms and so on. So did you see any of those?
As I have in my own experience, I think I have not had any second cancer. I mean, cancer itself being produced by mammography,
Right.
or any cancer coming out because of mammography. But it is definitely described in the textbooks. But I think it is very, very less compared to the benefit mammograms are doing.
All right.
And more than anything else, it is the mammograms have created that kind of an awareness now that around mammogram, other things are happening, that self-breast examination, clinical breast examination, MRI and all this. So I think we definitely need something non-radiological, non-radiation related investigation tool, like elastography and thermography, but they have not attained the sensitivity and specificity of mammogram still.
Right.
So more research is needed in that, but until that happens, I think mammogram remains our best bet for screening breast cancer.
Okay. Thank you.
Thanks.
Sir, is there any recommended set of exercises or duration of exercises which can be told to the patient who are obese?
It depends actually. I think according to us, normal people at least should have about half an hour of exercise, at least 3 to 4 days in a week. That's the minimum. What is the optimum? We still don't know. Probably everyday exercising may be the better option actually. But we have to look at other things like joints, and we have to look at other comorbidities, heart, everything. So it has to be individualized, and it has to be diet and exercise together. So if they are obese, I think diet probably is far more important than the exercise. And of course, both have to be combined. Both have got separate protective effect against breast cancer. So we need both of that. And sometimes even pharmacotherapy, drug therapy for obesity may be useful. Even sometimes even the bariatric surgeries can be useful. So we need to individualize that in obese women.
Sir, I was diagnosed with stage 3A breast cancer in 2023 May. So now, I mean, I'm advised to take TDM cycles of 14 cycles. First, I had chemotherapy 6 cycles first, followed by surgery and then radiation. Now I'm advised to undergo 14 cycles of TDM. So I'm
TDM
not
one,
sure.
yeah.
TDM. I'm not sure the efficacy of TDM. Is the risk outweighs the benefit, because there are a lot of side effects listed, like liver damage, heart damage, and everything. So I'm really skeptical about going for the TDM cycles. I just want to know your personal advice on which one would be better in my case.
Okay. You must be having HER2 positive breast cancer, I think. Is that right?
Yeah, I had triple positive.
Triple positive breast cancer. Okay. So triple positive breast cancers do well. And probably because you initially had chemotherapy, and then when they operated, still the cancer was present in the tumor, in the breast. And that is why they must have advised you the TDM1 for another 14 cycles.
Correct.
I think that is known to improve the survival. This in large clinical trials, it is known to, and in my own personal opinion also, it benefits you. Now, as far as the side effects are concerned, in practice, I think majority of the side effects don't occur. It will be 1 or 2 side effects which are manageable, and whatever is given in the literature is always scary. So we see even simplest of the drugs they give, because you are supposed to disclose everything. Even if it is 1 in 1 million chance also, you are supposed to disclose that. Pharmaceutical companies are forced to do that by the regulatory agencies. So they tell that, but most often nothing happens. So my suggestion is, if it is correct that after surgery also your breast had some tumor in the specimen, then you need this TDM1 treatment for about a year. Yeah.
Thank you, sir.
Okay, and should it be like full of 14 cycles, or can I cut it down to 10 or something like that? I mean, if
We don't know that actually. What happens is, in a trial they would have fixed it for 1 year or something like that, and then that would have been proven that 1 year if you take, you are benefited. If you do not take, you are not benefited. Now, if you take less than that 14, 8 or 10, do you get benefited? My own hunch is that you will be partially benefited, but the full benefit, if you want to get, I think you should follow that 1 year course.
got it. Thank you.
Thank you, sir. Dr. Sapnali, you want to ask any question?
Hello, am I
Yeah.
audible?
Yes,
Yeah.
yes.
So, doctor, I have one case who is known hypertensive and diabetic and diagnosed with breast cancer. So, just wanted to know, like, she has undergone the chemo and radiation and partial mastectomy also. So, we know that there are recurrence. Point number 1, chances of recurrence, how to prevent, and point number 2, that I have came across the cases where patient previously was cervical cancer and then again the breast cancer or vice versa. So is there chances this may occur, and how to prevent that situation?
Okay. See, that it depends on what was the receptor status of the breast cancer. Was it ER, PR, HER2 positive, negative? So do you have any idea about that?
Positive, sir.
ER, PR positive.
Yeah.
Was it HER2 negative?
No, it was positive, sir.
HER2 also was positive.
Yes, sir.
Triple
She
positive.
had family history. Yeah, she had also family history.
Okay. Okay. Any BRCA mutation has been done, genomic analysis?
I'll need to check that, sir.
Check. Okay. Okay.
Yeah.
So first thing is, if find out exactly what the tumor biology is. That is ER, PR, HER2 and Ka67. Ka67 tells us how fast the tumor is going to grow. So faster, if Ka67 is high, then recurrences can come very quickly. But if they don't come for 2-3 years, then you are mostly cured. So it happens in triple negative breast cancers and all that, where recurrences can be there common. But once you go beyond 2 to 3 years without developing cancer, then you are cured. Whereas if it is ERPR positive, you do much better, you live for long, but the disease can come back at any time, 10 years, 15 years later also, the disease can come back. So that is the problem with the slow growing hormone receptor positive breast cancers. Now, as far as how to prevent recurrence, it is the same as preventing the primary. I mean, preventing the first cancer, that is the lifestyle, the exercising, eating vegetables, fruits, avoiding meat, breastfeeding. If all the things which apply to the primary prevention will apply here also. And the most important, I would say, is taking anti-estrogenic treatment, that is hormone therapy, regular exercising, and being prudent about the diet. I think these are the most important things which she can follow. Now, taking vitamin D supplements is supposed to some extent prevent. I think it can be done, because if the if the calcium levels and vitamin D levels are especially lower, it will help a lot. As far as the preventing the other cancer, it is again the same thing. The lifestyle, no smoking, no alcohol, diet and exercise, on these things can prevent it. And doing BRCA or other familial genes, there is about 18 familial genes which can be mutated, and we can find out in a blood test or tumor test rather in the tumor, also in the blood also, and we can know whether there are increased chances of any other cancer developing. So breast cancer usually can follow. I mean, the second cancer which usually comes is ovarian cancer, sometimes endometrial cancer. These are the two common ones which can come. So we have to be careful about that.
Yes, thank you, sir. I will just add one more point. The patient had undergone total hysterectomy approximately 8 years ago. Same patient.
Oophorectomy was also done at that time.
Total
Okay.
bilateral.
If oophorectomy also has been done, of course, the chances of any of that developing is less. But the most important chance is the tumor itself coming back. I mean, the breast cancer itself coming back, and the breast cancer in the other breast coming back. So those are the two issues. So I think regular mammogram ultrasound will be useful in this patient.
Okay, sir. Every 6 months will be advisable?
Every 6 months, it depends on what was the early stage. I mean, what was the stage of cancer initially diagnosed?
Okay.
If it was early cancer, then you can do it once in 1 year. If it is the advanced cancer, for example, you said stage 3 or something like that. Is it stage 3?
Yes.
In case it is stage 3, probably you can do every 6 months. You can do a PET scan actually. That may be for some time, at least maybe 3 years. And after that, you can just follow it up with ultrasound and mammogram.
Okay.
Yeah.
Sir, if in case anything I would like to discuss with you regarding these patients, can we connect after the session?
Yes, we can.
Okay, sir.
Yeah.
Okay. Do provide your contact details later on.
Okay, sure.
Thank you, sir.
Sure. I will do. Thanks.
Yeah. Thank you, Dr. Swapnali. Thank you, sir. I've
Thanks.
taken your enough time, sir. Thank you for joining us and
Thanks for the
enlightening us.
opportunity.
Yes,
It is
sir.
my
Yes.
pleasure. Thanks a lot.
Thank you very much.
Thanks.